Managing tubes and drains for your loved one can be a scary responsibility. Watch this session a few times in order to feel prepared. Each of these pieces of medical equipment are designed to be used easily. Pause the sessions and rewind if you feel like you have not understood the instructions. If after reviewing, you still do not feel comfortable caring for the equipment, contact your hospice team. Pleurex catheter. Draining fluid from around your loved one's lung may help ease their shortness of breath. Some people find that this is painful. If that is true for your loved one, giving pain medication 30 minutes before is a good idea. Your hospice team or your loved one's doctor should have given you instructions on how frequently to drain fluid using the Pleurex. They should have also given instructions on how much to drain. First, wash your hands well with soap and water. Open the package containing all of the equipment. Keep the part that attaches to the patient in the plastic sleeve. Remove and discard the support clip. Close the roller clamp. Open the package containing the valve cap, but do not touch the inside of the packaging and do not remove the cap. Clean your hands again with Purell. Twist off the cap from the valve of the Pleurex catheter and discard it. Continue to hold the Pleurex catheter. Keep the valve from being contaminated. Take an alcohol wipe and clean the catheter valve thoroughly. Continue to hold the catheter while discarding the alcohol wipe. Pick up the drainage line with your other hand and remove the plastic sleeve. Insert the tip of the drainage line into the clean catheter valve. You will hear and feel a snap when the tip and the valve are locked together. Hold the bottle with one hand while you push down on the white T-plunger to puncture the seal. Slowly roll the wheel on the roller clamp away from the bottle to begin drainage. Pleural fluid should begin to flow into the bottle. You can slow the flow of the fluid coming out using the roller clamp. This is a good idea if your loved one is experiencing pain. When the fluid is finished draining or your loved one has become uncomfortable, close the roller clamp completely. Pull the tip of the drainage line out of the valve, use an alcohol wipe to clean the catheter valve well, pick up the new cap without touching the inside, and twist until you hear another snap. Tank off catheter. These catheters help remove fluid in the abdomen. If fluid builds up in your loved one's belly, they may have shortness of breath, less of an appetite, or even pain. Your hospice team or your loved one's doctor should give you instructions on how much fluid you can drain and how frequently. To drain the fluid, first wash your hands. Remove the cap on the tank-off catheter or open the valve. Have a basin to collect the fluid and measure how much you drain. Release the clamp. The fluid should come out freely. When you have reached the amount that you hope to drain, clamp the tube again. Use an alcohol wipe to wipe the catheter tip before placing a cap back on. Foley catheter. There may come a time when your loved one is not aware that they have to urinate. It is also possible that your loved one will not be able to empty their bladder and become uncomfortable. This happens sometimes as a side effect from medication or as certain diseases advance. If you notice that your loved one is wetting the bed or has not been able to urinate for an unusually long time, you should contact your hospice team. They may recommend a Foley catheter be placed to allow urine to drain freely. This can help with uncomfortable feelings of an extended bladder and minimize wetness of their skin, which can cause bed sores. Care of this type of equipment is relatively easy. Do not disconnect the system unless otherwise instructed by your hospice team. If it should become disconnected in the middle of the night, for example, clean the catheter with alcohol before reconnecting. Keep the catheter properly secured to your loved one's thigh to prevent movement and irritation. Keep the collection bag below the level of the bladder to prevent infection. Keep the collection bag off the floor. Empty the drain by releasing the clasp. Clean around the catheter with soap and water daily if possible. Venting gastrostomy bag or a drainage peg. This type of drain helps to ease pressure in your loved one's belly. Eating and drinking for pleasure is possible with this type of tube. The care of the tube largely depends on the symptom that your loved one has. The drain can remain open at all times, or it can be clamped and open depending on symptoms. If your loved one is eating or drinking, clamp the tube. If they then become nauseous or experiencing pain or bloating, unclamp the tube. Do not become alarmed if the color of the drainage changes to the color of whatever your loved one was just eating. Sometimes a person can have the tube clamped for a few hours before having the tube unclamped. The purpose of this drain is to let stool and stomach fluid drain and not cause an obstruction. If the collection bag becomes almost full, drain the fluid by opening the clasp and flushing the contents down the toilet. The drainage contents may smell. However, when the clasp is closed, you should not be able to detect an odor. Please remember that very little is absorbed when someone has a drainage peg, because whatever is taken in usually has to be quickly released. Do not keep the tube clamped if your loved one is becoming uncomfortable. Giving medications by mouth that are not quickly absorbed, such as a disintegrating tablet or concentrated liquids, will likely not be effective for the patient who requires a drainage peg, unless the clamp can be closed for 2 hours afterwards.